Assalamu alaikum wa rahmatullahi wa barakatuhu, guys. Welcome back to another episode of Under the Pomegranate Tree. I'm your host, Brother Ateiq, and today, mashallah, I am joined with another special guest, mashallah. I have with me Dr. Farooq, mashallah, who's a specialist in mental health and all things to do with the brain. He works very closely with the NHS. But I'm just going to ask Dr. Saab, inshallah, to quickly introduce himself. Assalamu alaikum, Dr. Saab.
Wa alaikum assalam wa rahmatullahi wa barakatuh.
Welcome to Under the Pomegranate Tree.
Jazakumullahu khairan for inviting me. So you asked me to introduce myself.
Please, if you could kindly for the public, inshallah.
Yeah, my name is Farooq Khan. I'm a consultant psychiatrist. I live in Birmingham. I'm here for the last 15 years. But I'm living in this country in the UK for the last 20 years. I belong to a city called Hyderabad in India. So rich for its biryani. People might have heard about Hyderabadi biryani.
Yes,
so
yes.
I belong to that city. But I've been working in the NHS right for the last 20 years. I'm here. And I work in the mental health. So I'm a psychiatrist. And I see a lot of people with mental health issues and problems. I'm also a visiting professor at the University of Chester and involved in a number of community activities and some charity organizations as well.
MashaAllah, barakallah feekum. Inshallah, hopefully we'll dive into a bit more about your speciality throughout here. But you mentioned the Hyderabadi biryani, and I do know that we have some, mashallah, Hyderabadis that tune in and watch. I was just living with some, when I went to Saudi Arabia, our Sheikh, mashallah, Muhammad he lives in Jeddah. They're originally from Hyderabad, and we had a big discussion of who does the best biryani, and he goes, no, hands down, Hyderabad, he's got the best biryani. And mashallah, we also had Mufti Abu Haj as well, mashallah. He lives in Detroit. He's been on the episode a few times. He's also from Hyderabad as well, mashallah. So I've heard a lot of good things about this Hyderabadi biryani. Maybe inshallah one day I get to try it, right?
Inshallah, Darul. We will, inshallah.
Barakallah feekum. So Dr. Saab, the topic of today's discussion is going to be all things to do, with the brain, mashallah. We go to the doctors now and say, okay, I've hurt my finger. It's very easy to diagnose it and it's very easy to treat it. But treatments of the brain are a bit harder to diagnose and harder to treat. So in a nutshell then, Dr. Saab, when we say, mental health, what does that actually mean in simple terms?
So you've mentioned brain a few times. So the distinguishing feature between the brain and mind, we have to understand. So brain is something which is substance, physiological brain, which is there inside of the skull. And the functioning of that is the mind. So we deal with the mind. So issues with the psychological problems, which are called as mental health problems. Now, mental health problems are quite a common, a lot of conditions are there. The most common ones you would have heard about is depression, anxiety, panic disorders, phobias. So these are originating from the brain, but not the actual substance or the physicality of the brain, but some of the neurochemical changes that happens in the brain. Most of the problems are because of that. And it is difficult to diagnose sometimes. A lot of the times because people do not approach for help. They delay, take a lot of time, and they just have no understanding sometimes what the mental health issues are and why somebody is feeling low and down, for example. And they put it down to many other reasons than depression.
So what you're saying is obviously it's good that you brought that distinction then, because the brain is the essence, right? What it is, the physical structure of what's living inside our skull, and the operating mechanisms inside it. That's the mind then, right? Absolutely. So it's not because somebody won't suffer from mental health because they've got a piece of their brain missing. It's probably just because that there's something going wrong with the neurons or something like that inside of it. Is that correct?
Absolutely. So that neurochemical imbalance that people might have. That is the reason for the psychological problems that people suffer from. So structure of the brain might remain intact. So many of the people whose brain is scanned, for example, who suffer from anxiety or depression or panic, you might not see structural changes in the MRI head scan, for example.
Okay.
But those neurochemical imbalance that happens, that results in those psychological.
And can you see that throughout these scans or whatnot?
So in the scans, it is not possible.
Okay.
But there are mechanisms through which the analysis of the neurochemistry of the brain can be done. But that is not normally done. It is on the research level if somebody is undergoing significant amount of drug trials, or researchers are doing the research on the brain and mind, then they will be doing those sort of neurochemical research. But generally speaking, we do not do those type of work on the mind and the brain. We do get the scans for other reasons. For example, if somebody has got a neurological condition, somebody had epilepsy, for example, or they've got an abnormal behavior presentation suddenly happening, and they scan the brain, it's a tumor or any infection in the brain. That is the substance of the brain getting affected.
But can you see like which part of the brains are firing at certain times? Like, I don't know. I'm by no means an expert, but some of the things that I've seen on like some of these A&E programs and hospital programs and stuff that you see on the telly, when they scan the person's brain when they're sleeping and they say, okay, this part of his brain is active, this part is asleep. How do they get to figure that out?
Yeah, so I think it's quite an interesting one as well. There's a huge amount of neuroradiology that is involved in the imaging, neuroimaging that we say, MRI scans, the CT scans of head, and then there are FDG PET scans or SPECT scans. Those PET scan and SPECT scan can specifically target out the lobes of the brain, the different parts of the brain, which are active and inactive, depending on the oxygen supply of the brain. So they can map it out. So they can map it out which area is hypoactive or which area is hyperactive on something. And that's how you come to know that area is not working properly because of the neurochemical imbalance in that area.
Okay.
So those FDG PET scans are very common. They are done in people where they have to map out the activity of the brain.
Okay. So let's just say, for example, I've got loads of questions, but I'm just sidetracking a bit. But let's just say now somebody's been diagnosed with like ADHD or some sort of autism or whatnot. Is that something that somebody can physically see on a scan with those, with different parts of the brain firing up or no?
So the specifically for the ASD, autistic spectrum disorder, you mentioned, and also ADHD, on the routine scans, the head scans of, you can't find a difference. You can't see a difference there because of the structural and the neurochemical integrity many times remains intact or in individuals. But then if you have got some problem in the brain which is causing that behavior, so that some issue in the brain which is like a growth or abnormality in the blood vessel, that can be seen.
Okay.
But those neurochemical imbalances, which are not seen on the normal brain scan, that can be seen in the FDG PET scan, for example. So there are conditions in the, for example, dementia. You would have heard about this condition. It happens in elderly people, and it's quite a growing problem. And I do specialize in that area in dementia. And you find a lot of places in the brain which are like temporal lobes, the frontal lobes. There, the FDG PET scans, there are new amyloid PET scans which can detect where the deficits of a neurochemical is there or a protein where is deficient, and you can get the results and you can see that.
Subhanallah, subhanallah. My granddad had dementia, and it got really bad towards the end of his life, and alhamdulillah, he's passed away now, may Allah subhanahu wa ta'ala bless him. But he, towards the end of his life, he became like a child again, right? And he had these memories from Pakistan, right? So even though he's here in the UK and whatnot, he had these really old memories. And we'd ask him, what did you do today? He goes, today I went to this mahalla and I went to this gully and I saw this shopkeeper and stuff. And he's beside his bed all day, and that was quite refreshing to see that. And then obviously it gradually got worse towards the end.
Yeah, subhanAllah, I mean, you give a very good example. So I think for our viewers as well watching, in dementia, there are different types of memories. There is a remote memory, which is long-standing. Things happen in the past many, many years back. Then there is immediate memory, which happened just now as we're talking. We're using the immediate memory to give references to things. How I've come here, how you have come here, when did we agree to come here? All immediate and recent memory. The remote memory goes late in dementia. So people have got intact memory for a very long time for things which happened years back. So you gave example of your granddad just now, who remembered things from his childhood, but wouldn't remember what happened yesterday or last week. What he had this morning, he wouldn't be able to recall. But he'll know his childhood friends and the lanes and streets of Pakistan when he's been playing. I think he would remember that. So that is one of the features of dementia in the early stage. But as the disease progresses from the mild to moderate and severe, people do land up in a very difficult state in which they might not remember anything. So both remote and recent memory will be gone.
Yeah.
You also gave the example of being like a child,
Yeah.
like childhood. I think in Quran it is mentioned, I don't know the verse, you might know, but that we will bring them back to the
Back to the,
childhood.
yeah.
So it is almost similar, not suggesting in any way that all dementia is like that, because it's a disease, obviously, of the brain. It can happen in older people, but Alzheimer's dementia, for example, is a separate entity, which is a disease that happens. So yeah, I think that's a really good example to note that how the memories can be different immediately.
Memories are amazing as well, and it's like I recently got reacquainted with a very old friend of mine, somebody that I used to know when I was a lot younger in school, and just talking to them for a short while, it started unlocking memories that
Yes.
I totally forgot about. And I was like, oh, remember this? Remember we went over here? Remember we done this? And it's like, yeah, memory unlocked, memory unlocked. And
Yes.
subhanAllah, it just goes to show that those memories are stored somewhere in
Yes.
the brain, and then you don't know when they're going to get unlocked. And dementia has a way of, I suppose, doing that, right?
Exactly. I think say you give another example. So how the memories are stored in the brain is very very different. So the analogy is of that of library.
Yeah.
So if you imagine classical library that is there, when you go in there and have to get a particular book, in thousands of book, how did the librarian go and search the book? So you will have an idea of how to store it at the first place. So you put down the science, you put down the fiction, you put down the forensic sciences, and all those you divide and classify them, then alphabetical order. And then you'll have got A, B, C, D listed in there. And then you check with the author, check with the theme, check with the sort of the plot. And then he knows where, in what floor, which rack, which side, and which shelf the book is there. That's how the memory is broken down and stored. And whenever there's a stimulus that happens, like the question somebody asks you, all that mechanism that Allah subhanahu wa ta'ala has kept with all of us,
Subhanallah.
it gets activated. And then those, so there is, all these are mechanisms that happens in the brain, and all that memory comes back to you as it is. And this is the pathway which is broken in dementia. So they
Subhanallah.
can't retrieve that information, which is
Yeah.
already stored in the
So it's
brain.
almost as though people are just throwing memories at them,
Yeah,
right?
and then they just can't, they can't pick it up and remember.
Allahu Akbar, mashallah, subhanallah. It's amazing and how Allah subhanahu wa ta'ala has created the
Subhanallah.
mind, man. Tia, so obviously you've been in this country now for 20 years. You've been dealing with lots of cases, I suppose, doing loads of diagnoses and treating people. So what are the most common mental health issues you see, particularly within South Asian communities?
So I think the most common condition that happens within all communities, I will say, is depression, followed by anxiety or mixed depression and anxiety. These are the most common conditions. You mentioned about the South Asian communities. These conditions are also very common in the South Asian communities as well. Apart from that, you'll also see panic disorders. So depression, anxiety, then panic disorders, then different kind of phobias people have got. So there's fears of things that happens. These are common conditions, but then you'll also have got some rare, I'll not say rare, but I'll say that slightly uncommon conditions, which are like OCD, the obsessive compulsive disorder. You'll see some people having some specific type of eating disorders. People might have some personality issues, but then there are bipolar disorders that happens. This is also one of the conditions which is not uncommon or rare. It is present in a lot of people. You might have heard about bipolar
Of course,
condition.
yeah.
So they switch between the low mood depression and then a high mood or hypomanic or manic phase in which they've got like elated and quite high in themselves. So that becomes a cyclical condition. That's why it's called bipolar disorder. And then more extreme forms of conditions are things like schizophrenia and psychotic conditions, delusion disorders. So I would say to the question, most common conditions, anxiety, depression, panic, phobias are the most common conditions within South Asian communities as well.
So how would they manifest themselves? How could a person know and come to this realization that I'm depressed?
Yeah. So I think this can be many times brushed off when you're talking among your friends or family. If somebody says that I'm feeling low and down, so if feeling low and down, everybody can have that. You had a bad day at work, and you go back and say that I'm not feeling up to myself. That is not depression. So when you talk about a depression, a clinical condition like depression, you need to have that clinical diagnosis or presentation which makes it a depression. So feeling low and down on a particular day doesn't make you depressed, clinically depressed. Everybody feels a bit low, a bit off on the day. But then if you continue to have this low mood, for example, we describe that as anhedonia, that is lack of enjoyment in anything, lack of pleasure in anything, feeling of hopelessness or worthlessness, thoughts of guilt. Some people get extreme ideas of not being here. Some self-harm, suicidal thoughts can be there. Lack of appetite, losing weight can be an important part. Sleep disturbance can be there. So these are some of the symptoms that can be present in individuals, and then family members or the person themselves can approach for help if you're having this for more than a 2 weeks duration. So that's the duration of the
Okay.
start of the presentation of clinical depression. So if you have 1 or 2 days of just off mood, you don't classify that as depression. You need to have a 2 weeks duration of having these presentations most of the time, most of the days. And then you can
But it's important then to obviously be in constant communication with people so other people may pick up onto these signs as well, innit? Because if I'm just feeling low, but I'm not talking to anybody or I'm not engaging with anybody, I probably just think I'm feeling lonely, right?
Yeah, so it is hard because that person who is like that, feeling that low mood, will not be willing to speak to people. So by themselves, so even if you're encouraging them to go out and speak and seek help, they might just say, no, I want to be on my own because they don't feel like doing that. So many a times the depression or any of the mental health conditions, people around you start to notice that first than you feeling yourself. People might feel a bit low and might take help if they're very well aware, and that's very good. If somebody's feeling anxious and having some panic presentation, they might go and ask for help. But it is low mood and depression sometimes. People want to keep to themselves, not interacting, and everybody will put it down to, oh, he's a bit moody today. He doesn't want to interact and talk. But that continues for so many days, that crosses like 2 weeks duration, then you need to ask for help.
Okay, mashallah. And then what about anxiety then? Like, what are some of the telltale signs for that person's suffering from anxiety?
Yeah. So anxiety is, I mean, we all use this term like I'm feeling a bit anxious. Again, that is not clinical anxiety. Anxiety means, again, they should have this presentation of palpitations. So heart racing fast, or my thoughts running fast. I'm feeling on the edge. I'm always checking on things whether I'm doing something right. Uh, there are some psychological symptoms and physiological symptoms of anxiety. So feeling a bit nauseous and choking sensation in the throat. That can be also a presentation of anxiety. Shortness of breath. So hyperventilating, taking the deep breaths in and out, and then you become quite breathless at that time. So people think that is it a heart attack or an asthmatic attack, but actually it's a panic attack, which is a type of anxiety disorder itself. So anxiety has got this element of some of the physiological presentation and some of the psychological presentation. Churning in the tummy. So I'm just feeling butterflies in the tummy. So that sort of feeling is the best description of the anxiety presentation.
Does it have anything to do with your gut?
So I mean, the feeling is almost psychological, which is presenting as churning or sensation. So you're not hungry. You might have just eaten, but you still feel that there's something in the tummy. You're not feeling yourself. And people describe that, and they go to the gastroenterologist. They go to the GPs to say that my tummy is not right. But later down the line, few months down the line after investigation, the GP might tell you that no, this is not a gastric condition or condition with your gut, but it is actually your mind.
That happened to me, you know.
Right? Okay.
So I went to the doctor now and I was like, Doctor, I don't know, man. I'm suffering from some severe IBS or something, right? And they said, oh, what did you eat? And I'm like, this is what I had and whatnot. And I got to such a point, right, Doc, that I was, I became anxious every time I was eating because it's like, I don't know now if what I'm eating is going to affect my stomach. And I cut out loads of things. I cut out all the things that I love, like fizzy drink, fizzy pop, pizzas, fast food, everything. And I went to this one doctor, right? She was a doctor from back home, but she's studying here. And I told her, and I said, Doctor Saab, mera masla bahut kharab hai. You get me? I'm tried everything, and I don't eat this, and I stopped eating this, and stopped doing this. She goes, Choro bhai. She goes, Zindagi ka आधा मजा खाने
Kind
पीने में है, right? So I go, so what is it? She goes, आपको दिमाग में फर्क
of.
है. Yeah. So she diagnosed it. All these Western doctors or whatnot, right? They was like, you take this fiber tablets and take this and take that and take these sachets and everything,
Yeah.
and none of it was working. And she goes, you got a problem with your brain, mate, right? And she goes, do you get stressed? Do you have problems sleeping? I says, yeah. And of course I get stressed. She gave me, I listed out some of the things that I get anxious about. She goes, this is it. And she goes, forget tracking what you're eating now and track how you're feeling and what's going on in your life. So then that's what I started doing. Every time I was getting closer to the exam times, I realized my stomach's playing up,
Yes.
right? Anytime somebody's called me to do a bayan somewhere, my stomach's playing up,
Yes. Yeah.
right? So I was thinking, okay, this is what it is now. But so how do you deal with that, Doc? How do you deal with this sort of stress and this anxiety? Because life's going to come in it.
Yes. So I think it's important two things in that. One, you mentioned about the stress
Yeah,
and the anxiety. So sometimes people do get a bit muddled between a mental health problem and stress. The stress is for everyone. So everybody is stressed in some way or the other. And
yeah,
that is not the mental health concern. That is not a mental health diagnosis. Stress is present somewhere. It is
yeah.
present outside. We take it all in and that make ourselves stressful, more stressful. Psychological conditions, mental health disorders, can be triggered by stress. So we talked about the depression and anxiety. They can be triggered by a stressful situation. You gave example of the exams. So whenever there are examinations, people are quite tensed about the examinations. You've not slept overnight, you've not eaten for the day, and the next day the exams, and you are feeling really anxious. There's something wrong with your tummy because you're not eating. You feel nauseous as well. Sometimes you have the palpitation and shortness of breath.
But if you ask me, Doc, oh, you got exams coming up tomorrow, how do you feel? I'd say, fine. Whatever will happen, will happen. I don't feel as though, but it's almost as though my body knows something that
Yeah.
I don't.
So I said to you there were two types of symptoms of the
Yeah,
anxiety. One is the psychological and one is physiological.
yeah.
So the physical symptoms of anxiety can be presented in that way as tummy churning,
Okay.
heart pounding. Heart pounding is not a psychological, it's a physical. Actually, my heart is actually beating. So it's not like I'm feeling my heart is beating. If you count my heart rate that time, it might be 150, 160. So that is heart pacing fast. That's actually the physical presentation of anxiety. And if you're going on the stage, for example, doing something there, your heart might be pounding. Nobody's doing anything to you there. You're not having a heart attack, but the anxiety is causing that to beat faster, to take deep breaths in and out. So that is the presentation, physical presentation that can happen in anxiety. So I mean, many a times people go to, as I said, to A&E. They have got a panic attack, but they're taking 999. They go to A&E because they think that the sweating, the heart is pounding, and they're having choking sensation, and somebody's thinking they're having a heart attack. But actually, it is down to the panic attack they're having. So panic attack is one of the common anxiety presentations. So stress, I think, is slightly different than the actual mental health problems. Stress will be there for everyone in a different shape or form.
Yeah, it's almost as though somebody explained it to me. Like I remember I watched something, or was it somebody talking to me? They said that you have two brains. You have one in your head and you have one in your stomach, right? And it's almost as though you need to brainwash the one in your stomach, right? So your mind has your gut has a mind as well, right? And you got to brainwash that and manipulate it so it doesn't communicate too well with that one. I don't know about that, but so Doc. Next question then. This is a bit more cultural and surrounding the stigma when it comes towards mental health in our community. So, why do you think mental health is still such a taboo topic? And I'm mentioning South Asian families because predominantly majority of our viewers are from South Asian communities. The majority of the communities that we work with are South Asian communities as well. And so that's why I'm just thinking, why is it still such a taboo and why don't people want to talk about it?
this is not straightforward. There's no straightforward answer for this one. There are many, many things. So one of the simple example is the taboo it carries is because of the culturally or traditionally, it is seen as something to do with some sort of supernatural or extra normal thing happening around you. So you're behaving odd in a way. Kuch aa gaya, saya, something has been happening to you. Although we all believe in the jinns, for example, the jinns has been mentioned in the Quran, and we know about that. But these things sometimes are exaggerated within the families and communities. So people start to believe things which are actually not there. So in the heightened state of fears, you can see things which are not there. But it's not like you're hallucinating. You're saying, but you've had a vision of something. When you're extremely anxious or very fearful in the dark of the night, you see something and you get fearful about it and you start to believe and build up. Many people traditionally in our cultures have attributed these to the mental health illnesses and those conditions having to do with the jinn or to do with some sort of saya or something like that.
Or black magic or
Black
something.
magic, witchcraft, or whatever you use. The voodoo is another, in different cultures, different terminologies. And that causes a hindrance in accepting that this is something wrong with my family member. And that's why the help is delayed.
But how do you know? What if he is?
So, first of all, if you have that sort of thing, what I have said to people in the patients and women, you want to practice some of those things, you do, but ask for help medically as well. So sometimes if you challenge that sort of a belief, you're not going to go anywhere. So you say, okay, that's fine. We continue with the work you're doing. Say, for example, people have got different treatments that are happening for that particular belief they've got, but then also go to the GP, get the help from the psychological point of view. So we're not asking somebody to stop something, but then continue with this treatment or this behavior therapy or cognitive therapy or some medication. You continue with that. So that's one reason why. Second thing is the recognition of symptoms. So we talked about early on what are the common mental health problems and how they represent. So if you're feeling low and down and you've got 10 problems at home, the family situation, your job, your boss, or economic conditions, financial conditions of people, this becomes as a low priority. So people do not prioritize this as something that you ask for help because they've got more crisis to deal with on hand. So this becomes a thing which can be left and you increase the problem, and from the mild to moderate to severe, the depression or anxiety increases without any help, and that person struggles and feels really helpless to ask for help. And that can increase the severity of the condition. So that's number two. Number three is we have seen in almost all BAME communities, that is the ethnic minority communities within the UK as well, approach to the illnesses, specifically the mental illnesses, is lowest, is very low in the BAME communities. So they don't ask for help for whatever reasons. It can be cultural, it can be traditional. People want to help and support themselves. That's fine. It's very good. Family system is very good in our cultures and communities. That's very good. But then even to the point that they suffer so much without asking or without appreciating that there is some help available. And I think fourth, I would say, is lack of awareness that there is something there to help. So people think that if this happens, I will be called mad, or people will call me crazy or names. I'll just not say anything. I'll not ask for help. What if there's no help available? So I think this lack of awareness among the communities that there is something out there, and many of the times this depression, anxiety, panic, phobias, these common conditions, they can be treated quite early with a short duration of time. People think about the medication, taboo of the medication, that I'll be forever on the medication. It is not like that. These conditions can be resolved quite quickly, quite easily within a short period of time if you do it early. If you leave it for a long time, it might take for a long time to treat as well.
Okay,
So there are
mashallah.
few, I think, reasons why
Yeah.
communities don't come
So
forward.
just touching on the first thing again, we're not saying that it cannot be spiritual. It cannot be, let's just say, to do with jinns or sihr or ain, hasad. There's loads of little things like nazar, right? It's a big thing, right? So all of these things are, we believe in them. They're part of our culture, but also seek medical advice as well. You don't want to pursue one angle and say no, it's jinn related, when really a tablet or something like that could cure it,
This is
right?
absolutely. I think this is the thing that people have to think and emphasize. I think the
Yeah.
viewers that whatever path you're taking, because people are not going to leave one or the other. So they believe in things which are right. As we said, there is a very strong health belief, and then we know that the belief is part of the deen as well. That people believe in the jinn that is there because it's there in the Quran that we believe, but then I don't take a treatment or seek help because I think it's completely that is the reason for my problems. That might not be the case. You might have a simple solution for that, which can resolve in some talking therapy. We've got online therapies now, and people have got behavioral therapy, cognitive therapy, these type of things, which can be dealt with within a short period of time, 12 weeks course, and things can be resolved.
But then you got the other side of the argument, right? Somebody who deals with ruqya and things like that, they'll turn around and say, well, schizophrenia is just a name, right? For something that the Western doctors don't understand. Somebody's hallucinating, they're seeing a figure. They are seeing a figure, but the doctor's saying that no, it's a hallucination. It's not really there because you can't physically prove that they saw anything. So they're putting it down to that. So it's a two-sided, isn't it, Doc?
Yeah, so I think an example is very good about the visual hallucination, what you just described, that seeing something which is actually not there. So you and I can't see, but the person who is suffering from that particular condition, for example, can see that. Now, we might need a full episode on this one. I think at some point we'll come back. But I think what the doctors or psychiatrists are saying is that person is, yes, that person is saying that vision of that hallucination as real as you and I are seeing each other. So for that person, it is that real. So hallucination is almost an image that you and I are seeing. Auditory hallucination, hearing of voices,
Voices, yeah.
it is as clear as you and I speaking. So there's no difference in that it is actually a real, as if a real voice is speaking. But you and I can't hear, but that person who is suffering can hear. So I think the visual hallucinations or auditory hallucinations are part and parcel of the schizophrenia spectrum of the clinical condition. Now, whatever the belief of an individual is there, that they believe, don't leave the treatment that has been prescribed to them. So, and I would say that ask for help for these conditions quite early on. If somebody is hallucinating, you're saying that people doing ruqya, but go to the GP as well, consult the doctors, and get a specialist help.
Yeah, and I think a person who's a good Iraqi will also advise that. But problem we're having now is there are some sort of like, I don't even call them Iraqis, I call them like shamans or things like that, right? And they really take advantage of people, right? This person's come to them and they obviously suffering from mental health, and just so they can line their pockets with some money, say, yeah, bhai, aapke paas to jinn hai, you got a jinn with you, or you got black magic, give me £500 and I'll fix this for you, or I'll give you this taweez and this, that, and the other. And the person's throwing all this money at this person, thinking that they're going to do, and really it's a medical condition.
Yeah.
Right?
So,
So it is, I'm not saying that people are like, everybody's like that, because like you said, that is real as well. It could be, but getting the right diagnosis and earlier on as well is really, really important. So yes, if you've made a conscious decision now to go and see a Rocky, also consult your deep GP, right? And then you'll have more of a, you know, a better idea, and you can make more of a conscious decision then of what's going on, right?
absolutely, I think that is important. I think for viewers as well, it's very important to ask for help early. Seeking help early will be important, and also I think taking those treatments very seriously, because schizophrenia is a serious mental condition. We talked about depression, anxiety, which is a common condition, but the schizophrenia or psychosis is a serious mental health condition. So it has to be taken like that, I think, seriously, and to be dealt with and treated properly. And it takes long time. The schizophrenia will take a long time to get treated, and the people are on the treatment for a long time as well. So I think I would suggest that people having those problems should seek appropriate take medical advice on those conditions.
Barakallah fikum. And just don't suffer in silence, guys. You know, supposed to talk to somebody, right? Okay, next question. In your experience, and Doc, how does this lack of talking to people, I know you've spoken briefly about it, but if you can just elaborate, because we want to get people talking, we want to get people in other communities talking about mental health. But before I go to the next question, you're from Hyderabad, right? What is the Urdu terminology for depression?
If I give a proper Urdu
Yeah, give me a proper
term,
one.
a lot of people will not might not understand. Um, uh, it's a Mayusi is a common term that is used for the in Urdu
Yeah.
language, feeling sad, Mayusi. There's a specific term like Pashmardagi is another word that is used for depression or low mood.
Okay.
It's very difficult to translate some of the English terminologies to exactly an Urdu version of that.
So we're trying to say here is that we don't have the language to talk about it. Maybe that's why our elders and whatnot, they're suffering in silence because there wasn't no use to doing it. No, ये तो पागल है भाई. Yeah,
Yeah,
ये मायूस है, ये नकम्मा है, ये कमक्कल है. All the ones that I've turned are all derogatory,
terms.
negative terms. I'm struggling to find a positive terminology. Like somebody could say, I'm feeling sad today, I'm feeling down. Okay, it's depression, it's anxiety. You've given it a medical terminology now. Now I feel better talking about it because now I know it's a medical condition. But if I'm constantly going to somebody and saying, मैं तो खफा हूँ भाई, मैं मायूस हूँ, right?
बिल्कुल.
We don't have the language, do we?
No.
That's why I asked you, and you said one now, Pashmardagi.
Yeah.
Yeah,
So it's,
like,
the terminologies have, because mostly this depression and anxiety is psychological work that has been done in the Western countries. You've got the language, common language, and even the clinical language
yeah,
coming
yeah.
from the same. So you don't have specific terms. So you use the terminologies of feeling मायूसी just जो term है या उदास है या अफसरदा एक
Okay,
another term is there अफसरदा. So
Afsarda.
so
Okay.
these are some of the terms which might be closer
Yeah,
to
yeah.
the depression, but not the exact meaning of depression.
If somebody's talking, let's just say somebody's talking about schizophrenia now, their relatives got schizophrenia, somebody in their family, what they're gonna say? You're gonna say, उसको छोड़ो बाबू, थोड़ा पागल है, right? And people don't want to talk about it because they don't want to be classed as pagal.
Exactly.
Yeah, you tell him no, he's got schizophrenia. Oh, okay, what's that? ये
Yes.
क्या है? दवाई खाता है.
Yeah.
Okay, ठीक है, he has medicine, this, that, and the other. But calling somebody pagal or for our Bengali viewers, fagol, right, right, right. Calling somebody like these sort of terminologies, it- who's gonna want to talk about mental health, right?
Yes.
So I reckon we need to, Doc, if you can help me here, try and think of some sort of good terminologies that we can use in Urdu and in Bengali and whatever language, right? Because the Quran talks about it, right? The Quran gives us terminologies, huzn, hum,
Yes.
and things like this. So, there are terminologies that we can use. But I reckon in the South Asian subcontinent, especially, we could definitely use a bit more positive terminologies to discuss this type of stuff. But the question was, Doc, what are the harms then? If we don't have the language to talk about it, or we don't have the, let's just say, the oomph to talk about mental health, what could be some of the detrimental effects?
So I think one of the clear one is the taboo and stigma, because you don't talk about it, then you just either suffer in silence. You don't think that it's important. It is not on par with the physical health conditions. So people say about you mentioned a few things about pagalpan, yeah, these people talking about crazy, going crazy. And these terminologies are very common in the subcontinent. So if something happens to you, he's gone mad. So people who are 60 years of age can't remember properly things. Oh, he तो सटिया गए हैं.
Yeah,
He's gone off at 60, सटिया. 60 के बाद ऐसे ही होता है.
yeah.
So this is the things which people have this stigma that is known as crazy. So that's why people don't want to approach help or get any help because of the stigma. I think one of the things in talking point you mentioned about a few times, I think we need to be quite open about the mental health conditions in the communities. So whenever I'm sitting with our gatherings in our communities and societies, I do talk openly about the mental health conditions, and people come to me, and I approach them to say that what is depression, anxiety, how and why should you should ask for help, and go and talk about this. And even people, children, should be talking about it. In the schools. They talk, they let people know, but in the homes, I think many a times these topics are taboo topics. So whenever you're having community gatherings, some mental health well-being, as you talk about the physical well-being, talk about mental health well-being as well. Talk about things where people can get help from. So it can be primary care, it can be your GP, your doctor, but it can be also other community organization. There are many mental health organizations. Mind is one of the common mental health organizations, which improves the awareness among
Yeah.
people about these mental health conditions.
Let's get talking in it. I suppose that's the message over here. Talk more about it, and then once we talk more about it, maybe we'll start thinking about some better words to use about it, and then we'll feel a bit more comfortable. Because you're right, in schools there's a massive push now on mental health. In workplaces now, before workplaces never used to have mental health first aiders. Now everybody's expected to have a mental health first aider because as a society, people are getting more aware about it, and I do think that these conversations need to happen a lot more, not only in the homes but also in the masajids as well. I think as imams and as faith leaders, we should be aware of what's going on. What are the current scientific knowledge is available now to understand people's mental health, because somebody who's studied like a Dars Nizami, for example, or an Iftar course, or they're a qualified alim, they're a qualified mufti, but they don't know what mental health is, right? So I reckon we need to start introducing some of these topics to these, because if you're going to be going out and you're responsible for a community, now you should at least be able to, as a bare minimum, be able to signpost at least to the correct organizations, right?
I think I agree with this, and I think I support that, especially in the masajid. One of the common places that you as imams do get opportunity to speak to your uh, audiences or musallis is the Jummah khutbah. I think Jummah khutbahs, these sermons should take the one of maybe once in a month a topic of the mental health well-being. So have sort of depression and anxiety and talk about that in the khutbah. And you can have many examples. You mentioned about the dua, about the huzn, and the I always try to memorize that dua which skips from my mind,
Yeah,
which
I'm looking for it now. This is why I
yeah,
got my other
so,
phone now, because
yeah,
I'm
so
actually working on a presentation now to do, yeah, on
yes,
mental
but
health.
it has got sadness, it has
Yeah,
got anxiety, it has got the bukhl,
yeah,
it has got the qahr al-rajal. So
yeah.
that dua is very, very powerful. So I think you can, the khatib and the ulama and the imams have got this, I think, opportunity that every week you have got 20-25 minutes to talk to the people uh, every week. So you can select one of the weeks to have these type of discussions.
I think Jummah khutbahs is very, very important, but then the guy needs to know what he's talking about, right?
Absolutely.
So I'm working on a presentation now, and inshallah, once it's complete, I want to send it over to you. It's basically on the studies of Sheikh Abu Zaid al-Balkhi, right? And he was one of the founders. He was from 850 to 934 CE. He was a 9th century Islamic scholar and a physician, and he was born in Afghanistan. Have you heard of him?
No,
So he done a lot of studies on the body and the soul, and he was one of the first scholars that actually started talking a bit more about mental health. When you said earlier on that our mental health, a lot of the advancements and a lot of the topics have been brought on about by Western doctors. I thought to myself, hang about, well, this guy was in the 9th century. He was talking about it. If only people had continued this type of work and carried on doing it, we would now have something like this in our Dars in
that
Islamic syllabus.
advancement would have
That
been part
advancement.
of your education of a lot of the courses that happens in the Islamic
Exactly.
courses that happen.
Exactly. So inshallah, I'm gonna do this, like, what is anxieties? All this is here. So inshallah, I'm gonna be sending this over to you. Inshallah, I want you to do a little bit of a nazar sani of this. Is not ready yet. I would have spoken a bit more about it. Inshallah, maybe the next time you're on,
Inshallah.
inshallah, I'm gonna get another Rocky with you as well to sit down there. Maybe we can like see what's what. Because I'll be totally honest with you, I do a bit of the counseling side over here. We do faith-based counseling over here, and I wanted to understand. I've done some mental health courses and some counseling courses, and I wanted to understand what is the difference between mental health and spiritual ailment, right? How can we be able to differentiate between a person who's suffering from mental health and then suffering from a spiritual affliction? And the only way you can do it is if you know both sides,
Yes,
right? So I'm still learning. I'm still going to get there, inshallah. So I'll let you know how I get on, and
inshallah.
hopefully, inshallah, we'll be able to talk a bit more about that, inshallah. Okay, sir. So do you see any differences, or sorry, do you see differences between first generation parents and younger generation when it comes to mental health awareness? I know you spoke a bit about it when it comes to schools and colleges. There is a bit more
Yeah.
discussions happening
So I
about.
think younger generation, I'll say the second generations in here who are growing up and going to the education institution here, they're more open. They know, they are not shy of talking about this. And there is a lot of mental health awareness within the schools that is already happening. As you've talked about, there are mental health champions within the schools. That each school should have that, and there should be a first aider, which was not there a few years back as well in here. That has been introduced now. And you've seen the self-harm among the kids and teenagers increasing. We've not touched upon a lot of other issues, the knife crime, the drug crime, those type of issues, which are quite linked to the mental health problems as well. The drug taking behaviors, which is quite common, and even the other things like alcoholism and all, which is again part of the mental health issues
Yeah,
that
because it's escapism, right? You're
yes.
escaping from something, and that's probably something that's affecting you mentally.
Yeah.
Yeah.
So I think it's both to and fro. I think that impacting on the person's personality and the mind, and then that is causing them craving for the drugs and those behaviors. So I think I'll say the generation wise, the second generation here who are going to the schools and colleges, universities, much more aware. The previous generations have not talked about it a lot because I think, but I will not sort of blame them because they're not aware. I think the lack of awareness was something they've suffered maybe in silence. They've not talked about it. But the young generation are able to talk about it. I'd also say that one of the things about the resilience, but I'll see that one of the resilient factors you need to develop, every child, every person has to develop that resilience, and that is emotional resilience. That we're facing a lot of stress now these days, and stresses are coming every day. It's a new day with a lot of loads in the media for anybody to get stressed and depressed and anxious. So you need to develop that internal emotional resilience, how to face this world, improving your self-confidence and self-esteem. And again, these things are something which we can talk about it at some other point. But this is something which the new generations, younger generations, have to develop in themselves. Maybe the previous generations have some resilience in them, which has to be transferred into the younger generations.
I just remembered I'm actually a mental health first aider here at Darul, but nobody's come to see me yet. So I think, alhamdulillah, either you guys are doing well or you just don't know that I'm here. But if you're here involved with Darul Ilm, if you want to talk to somebody, come check me, inshallah. Tuesdays and Thursdays between 11 and 2. We're here, inshallah, just to listen to you. Because I went and done like a 4-day crash course with QualSafe, how to become like a mental health first aider. You know, in addition to some of the other qualifications and the courses and stuff that I've been on. And you'd be surprised, man. People are suffering in silence. People are suffering at work in silence, and they just don't know. And you know, it could take one thing to throw a person over the edge.
Yeah.
And you think, well, that was a bit of an overreaction, mate. That was something so simple, but you don't know what he's been going through
Yeah.
all of that time. Do you know what I mean? It's like they gave the example of somebody wakes up and they spill some tea on their clothes. The average person will just wipe it off. Don't worry about it. But if you've woken up late,
Yeah.
right? Then you spill tea in your clothes. Then you've got late for you've missed your train. Then you've arrived at work, and the meeting's already started without you, and you're playing catch up. And then somebody turns around and says, "What happened to you, mate? You woke up on the wrong side of the bed."
Yeah.
That's it. He's dealt with all of that stuff, and that one comment was just enough to throw them over the edge.
Absolutely.
Don't be that one person. Come see me before that happens, inshallah. We'll listen to you. ठीक है हजरत. Moving on then. So a bit about the environment and society. So how much does our environment affect mental health?
Yeah, so I think we have mentioned, I think, stress many a times
Yeah.
already, and we give examples of this knife crime happening and the drug beings and all. These type of behaviors will have quite an environmental influence on individuals. So when children, teenagers go out of the house, obviously they are going to the schools, universities, they're mixing up with a lot of people around. They've got friendship circles, which parents might not be aware of what they're doing. So all these have influence on them. In front of the examinations, how much preparations they have done, are they spending enough time to read, to study, and to make themselves aware of how to appear for exams. Youngsters who are going for the interviews, for the jobs, lack of job opportunities, economic situations. People have got different crises with the situation at home, personal life. So these are the factors which have influence on the mental health of people. And when you're not able to cope with that, deal with that, and not able to ask for help, because what we have seen for the last so many minutes we're talking about is lack of awareness of people to ask for help, and they think that they will be able to manage, and they might be going downhill on that, not able to sort of get any help or support which is available there, but they don't know how to get and how to approach for the help. So environmental risk factors, some of them to do with the communities in which we're living, they are quite stressful times, and going through the difficult period of change. So we have seen children growing up into teens and into adults. That is a very sensitive time period where the parents have to be very mindful of how they deal with the children at that time. And then teachers have got a significant amount of role uh, to play as well. How they support the children who are having difficulties in their behaviors, in their presentation, how their personality is going, how their esteem is developing. Are they having good self-confidence to stand and say what they want? How, if there's in need of help, whether they can ask for help. So I think those things, environmental factors, are important for the mental health
We're talking,
well-being.
you can, thank you, doctor. You can talk about like low scale as well. Like, for example, personally, if my desk is cluttered, right, I hate it, right? When I sit down to do either some research or when I'm answering questions, whether it's fatawas or stuff like that, right? And yeah, I have to sit at my desk quite a bit and I'm researching and I'm finding stuff out. But if I've got like clutter, like crumbs, my kids have been writing or whatnot, and they left pieces of papers, I'm not going to do my best work, right? I need to declutter my desk, everything, give it all clean up, even if it means like vacuuming the floor and all of that, right? Before I can sit down and work. Would you class that as like OCD?
So I would say the obsessive, maybe, not the disorder.
Okay,
So
okay.
OCD has got the disorder in that. So disorder, when we say, so obsessive compulsive disorder, any
Yeah.
disorder when we say, when there is impact on the personal, social, family, occupational well-being. When that is impacted, then it becomes a disorder. So I'll say you're a bit more obsessive on that. And yeah, I mean, having the desk clean before you get started is a good sign.
Yeah.
But if that is impacting on your work itself, so you're delaying it for an hour or two, and then quite occupied all the time, and if somebody disturbs it, you get anxious.
Yeah, I do, you know.
And then you respond to them in a very harsh manner, then it becomes like, and maybe you're having some traits of obsessive
I
compulsive.
don't think I'd react because it's normally my kids who mess up my desk, yeah. But they don't feel the backlash. It's more times going to be my wife. I'd be like, please, can you just go upstairs here and just sort my desk out before I start working or whatnot? And you know, bless her, mashallah, she does go upstairs and 9 times out of 10 and does do it, right? But I've got to be very conscious of her mental health as well, you know me, at the same time. So sometimes I'll have to do it myself. But just before we move on, I used to work for these guys, for Scottish Power, the company.
Yeah.
So we used to have like meetings and stuff with people who are based in Scotland. And I used to be there, quite jovial with them, laughing and joking. I says, guys, man, you guys are proper miserable, innit? Right? To these Scottish guys, right? And one day the guy just got fed up and he put the camera and he goes, look at this weather, right? If you had to deal with this, right? Yeah, how would you feel constantly? So environment, weather can play a big difference as well, right? Sunlight
Absolutely.
and a sunny
Yeah.
day, people feel a lot more happier. When it's miserable outside and it's raining and whatnot outside, you're going to be down. And if you're living in some harsh places in Scotland, who's going to blame you for walking
Yeah.
around with the grimace on your face?
Yeah, you reminded me now of a condition called seasonal affective disorder.
Yeah,
So
okay.
there is something which is a low mood and depression-like presentation that happens mostly in the winter times when it becomes more darker and there's less to do outside. And the mornings are quite dark as well, and the evenings like 3 o'clock, it's almost 2:30, it's dark.
Exactly, because you leave your house and it's dark, you
Yeah.
return and it's dark, and the whole day you've been sat at your desk.
Yeah.
Yeah.
So I think that happens mostly in the winter times as well. So and also I think it reminded me of another experiment that I've talked about many times, which Martin Seligman has done in some time in 70s, which was learn helplessness. So he's put experiment of dogs, in which training a dog. So every time that the dog is given a shock and tries to go out to run away from the cage, it's stopped. You can't get away from the cage. So shocks are given, and there is no escape. So after some time, when you open the cage door and give a shock to the dog, or even have a signal that the shock is being given, the dog will not escape because it has caused developed learned helplessness. That even when there's help available, when escape is available, I can't be bothered to run away.
Yeah, yeah, yeah.
And I think that situation causes depression and low mood. So I think when you've got an environment in which escape is not possible, you're suffering from a situation where you can't go anywhere, you feel miserable, low, and down. And that is learned helplessness.
Somebody, I've heard that example before, but somebody told me this example of this elephant farmer in Thailand,
Yeah,
right? And the elephant was tied to a small stick.
yeah,
And I was like, well, is this going to be enough to hold this elephant down?
yeah.
And he goes, well, from a very young age, he was
Absolutely.
pulling on this rope, and he could not let it go. And now he weighs 3 tons and he's huge, right? But in his mind, that stick is still
Yeah,
tougher.
the chain is small
Yeah,
chain
yeah, yeah.
tied to a small stalk there. So
Yeah,
if he pushes, if walks around, it'll be pulled off
but
the
it's
ground.
learned
But
helplessness.
learn helplessness. Same with the horse, for example. You put the horse by the tree or by the small branch, it will
Yeah.
not go anywhere.
Subhanallah.
Right from the childhood,
Look
it
at
has
that,
been
man.
taught to that. So that's the learn helplessness examples.
Just a quick example then about environment. Look, here in Birmingham, we've got a huge pandemic now when it comes to rubbish, right? Do you think, because I enjoy walking now, right? I was told I'm putting on some timber, right? And I need to walk a bit more. So I try to walk it quite a bit now everywhere I'm going, whether it's home to here, here to home, and whatnot to the shops. But I'm walking down and I get triggered now when I see rubbish. Because we do litter picking here on the Saturdays with the kids. So we're out there picking up all this litter and whatnot. And when I see all this litter and rubbish anywhere, it sort of triggers me. It puts me in a foul mood. And I'm sure I'm not the only one. So would you say that here in Birmingham, because of the constant litter, those nasty smells that people are taking in, is that going to be affecting people's mental state?
See, I would give, so I'll compare it with something. So if you are living in an environment, home or neighborhood or surroundings, which as a child you're growing up and seeing the same thing, similar type of thing every time. So for example, your home situation is such that it's always cluttered. It's always there something in the home. The children are seeing the same thing. They're growing up, but they're seeing everything thrown around. Nothing is being organized, nothing is kept in an order, dirty, unclean. That will be there in the child will be seeing that and learning that regularly, day in and day out for years and years and years. When he's a teen, he will not learn to clean himself or surroundings. He's happy to live like that because that is a norm for him. So this is what happens generally in people. When you see these things over a period of time, you learn.
Get
And then you think,
desensitized to it, would you say?
absolutely desensitized, and then there's no change. You don't want to change because that's your comfort. That's what you have learned to be comfortable in. The untidiness, the dirt doesn't come across as dirt. So when you go and see, you visit the place and say, oh, why are you living like this?
And he's like, what?
But yeah,
This is clean?
that's normal for him because he's just seen that. So it's not about, and it's nothing to do with the wealth, or it's nothing to do with the good houses or posh houses. No, It is just that cleanliness which should be there in individual, and because you're doing it. So and children pick up on this quite easily when they see the mom and dad doing it every time, constantly cleaning up. You tell the toddler, so it's time to pack up now. Good. So 1 day, 2 day, 3 day he'll not do it, but third day he'll sit with you and start putting things together. So I think this is similar to the example you gave about the rubbish or the environment around you. You become used to it, and then everybody is not bothered because thinking that everybody's that's normal. That happens. That tip is always there. That is always like that. So there's such a and Paki Adha Iman hai.
Yeah.
So this is where is it? We stand
Exactly.
in
Like,
front of this
the
stage.
friend that we went to see in Jeddah, he came over here as well. And he's driving, we took him out to eat and somewhere, and he's like, it's a very nice flash restaurant. But right outside on the doorstep, there's a whole heap of like black bags and nasty smells. And he goes, "Where have you brought me?" And we're like, "Listen, just close this eye and just use one eye as you walk it in and whatnot." And I was thinking, okay, I never even noticed it initially because I think maybe I got desensitized to it as well again. But then he picks up onto it because they, in Saudi, all the roads are clean. They got cleaners there brushing stuff up and raking up all the rubbish and all of that. We don't see that over here. You see a few guys now, doing community service around here, whatnot, picking up a few things. But I don't know, it's getting really, really bad around here. Well, Sheikh, do you have time to like continue? We have gone on a bit, but I still got loads of questions.
So no, I think can we continue?
Yeah, yeah.
What will be part two?
Part two. Yeah, man. All right, we'll do a part two then, because even
We'll
Amin messaged me and that and said, "Listen, we're up to an hour. We try to keep like the messages up to an hour,
Yeah.
and see how your legs are hurting
Yeah.
as well. Sat on the floor all this time, guys. We need a new studio, man. Yeah, I'm putting the link below on this episode. Right, please donate. Right to the for the new studio, please, so we can get some proper chairs and stuff in here. Mashallah, the setup has been done nice for us now. We'll keep it, but we need something else. ये में हमारे बुजुर्ग हजरात आते हैं, ये में उनको ऊपर बैठाना ज़्यादा मुनासिब है इंशाल्लाह. Nah, mashallah, you're young still. But look, I had 15 questions down over here. I haven't even got to the juicy ones, but you can see how much of an important topic this is on mental health. Doc, whilst I got you here now, you're going to promise to come in for a part two then, inshallah.
Inshallah.
Yeah,
No,
because
I will be here.
I've sent you the questions,
No,
right?
I will be here. Inshallah, we'll talk. We'll
Yeah, we got to pick this up. So we've sort of set the stage, and hopefully, inshallah, if you can come back soon, we can do like a part two immediately after this as well, inshallah. Agar next week, yeah, is tarah kuch ho.
Inshallah,
Time ho,
I
inshallah.
will come back. I've enjoyed this.
Yeah,
So we'll come back.
mashallah, good stuff. I'm happy. Okay, Duck will be back, guys. We had loads of questions. We haven't even got to the Islamic side of stuff, how Islam falls into mental health, and I spoke about it briefly, but we want to get into that. We want to talk about, some other effect that's happening in the communities, how men don't talk about mental health and things like that. So all of these stuff, the juicy stuff is still to come, guys. I hope you took benefit from this. Doc, before you go, anything that you want to advise our viewers, inshallah?
So I think one of the take home from this part one would be the importance and significance of the mental health issues. They are very important, and we can't ignore them. Second thing is when you need and think that there's a help needed, ask for that help and ask and approach for help. Whatever you're doing, are you in a university, in the college, school, or your job, wherever you are, talk about the mental health. And in the family specifically, don't make it a taboo or a stigma, because it is not. It is your health. If it's as you're concerned about your physical health, you need to be concerned about your mental health as well. And health, but WHO defines as both components of physical and mental health. That will make a health a health. Otherwise, it will not be. There's no health without mental health.
Subhanallah.
And keep watching and keep donating as well.
Okay, mashallah. Thank you very much, guys. Inshallah, I will see you again in the next episode. Assalamu alaikum wa rahmatullahi wa barakatuhu.